Welcome to Health System CIO's interview with Phil Alexander, Chief Information Security Officer with North Mississippi Health Services. I'm Anthony Guerra, Founder and Editor-in-Chief. Phil, thanks for joining me.
Thank you, Anthony. Appreciate it. Glad to be here.
Uh, Good. Looking forward to it. Do you want to start off by telling me a little bit about your organization and your role?
Sure. I am, as you said, Chief Information Security Officer here at North Mississippi Health Services. We are the largest health system in the rural health system in this region. We have 7 hospitals spanning Northeast Mississippi and North Alabama. Of course, many hundreds of clinics and nursing homes, and we're also a payer as well as a provider. Lots and lots of history, almost 100 years old. And very proud of our region and the people and clients in which we serve.
Excellent. So I think the rural thing will come up in our discussion. I know there's some unique challenges around cyber that rural organizations face. So, but I
Absolutely.
want to ask you sort of a wide ranging and just see where you want to go. So you could either answer what are some of the trends you're looking at or some of the things you're working on, if you're comfortable with that, but just in general, sort of what's on your mind.
Yeah, I mean, obviously, I try to keep my team focused on the basics, right? And it's not the sexy stuff. Nobody likes to talk about the basics, but it's the basic old school stuff that's been going on since the 90s, early 2000s. I mean, do we have the same? Do we have antivirus on everything? Are we patching? Are we updating? Are we, how's our firewalls? I mean, all of these things are people like, no, everybody should have that. Yeah, should is the key word. And so I try to focus on that. But at the same time, all of the Hollywood lights and smokes and mirrors pop up like AI, and like robots, and we can't ignore the new stuff. And so when those things come up, and I call them fad stuff, and I'm not saying AI is a fad. I'm not saying it's going to go away. I'm not saying bots are going to go away. We're using some of those in our hospital. Those things are starting to happen, and we have to address them from a security perspective. But at the same time, we don't want to get over too far in advance. We don't want to go too far too quickly, because a lot of things are, I think about, for instance, Google Glass. I remember when Google Glass first popped up, right? Everybody wanted to use Google Glass in the healthcare setting. I had physicians, I was in an academic medical facility at the time, and we had physicians who were also teachers at the university. And so they wanted to use Google Glass during their surgery, great use cases. I mean, I'm not saying they weren't great ideas, but that quickly faded, right? It didn't last long. And so you think about ChatGPT and some of the other technologies that are coming around, and we've got the same kind of thing. We've got physicians wanting to use it today, and so we have to address those pop-ups, as I call them. I think AI is here to stay, and I think it's just going to flush itself out into our culture, and we're going to have regulations. We're going to have processes in how we do it. But I don't like my team or the hospital to focus too much on those big pop-ups like that. Let's keep focused on the day-to-day, boring, everyday kind of stuff that really, at the end of the day, is the core foundation of security.
Yeah, it's kind of funny. What if you had put your whole team on Google Glass and said,
Exactly.
we're not doing anything else. I want you guys on this.
Fixate it. Let's see how we can secure it. Let's work on it, do all this stuff, and spend a lot of time, and exactly.
Good stuff. So blocking and tackling is important. Everybody knows it's important, but it's not easy. Why is it hard to get blocking and tackling right?
Well, before I joined this call, I was just on our annual budgetary call with the CFO. And so I think that's the key, is like when you're trying to explain to the CFO or CEO those blocking and tackling things. First of all, it's easier to get funding for new sexy initiatives, right? Virtual care, something new that's going to, these robots that's going to, we have staffing problems, so let's get some bots to take over. Those make sense because those are cost saving initiatives. But we need more space, or we need storage, or we need VMs, or we need to upgrade from an 08 server that's been around for a long time. We need to get it off of that to something newer. Trying to explain these blocking and tackling basic stuff from a budgetary standpoint to a CFO or CEO is difficult. Second of all, Even in IT. I mean, a lot of times the basic stuff, doesn't get uh, the love it needs in IT, because people want to work on the newer stuff. The basic stuff gets left behind. And there's so many projects. We are trying to work on projects that are for the customer, whether you're in healthcare, and for us it's healthcare. But in healthcare, all the projects, a lot of the capital projects that come in, that's what gets project management attention. The blocking and tackling never get listed on a project management list for the next year. And so you have X amount of hours spent, or budgeted of resource time for capital projects. But unless you have a very dedicated PMO process that also allocates the KTLO hours, in your PMO process, then those get left behind. And so it's very difficult. You got finance, you got PMO, you've got IT. Everybody forgets about the basic blocking and tackling items of your firewall maintenance, your patching and patch management, all those basic stuff that's got to get done every single day that take time, but all the time goes into the sexy capital projects.
So we got some good acronyms there. I don't know. Can we use B and T for blocking and tackling? Because I already got KTLO. If we combine those, we got B and T KTLO.
That's right.
Right?
So Kate, yeah, that's right. I know.
It sounds like a
I get it.
radio station.
I get
KTLO. Yeah.
KTLO. That's right. WKTLO. Coming to you live. Yeah, I get harassed all the time. I used to work in the government, so I use a lot of acronyms. But yeah, for those who may not know, keep the lights on.
I got it.
Yeah. So
Yeah. So B and T KTLO. So you mentioned that, we understand that, and you're talking about robots and things like that. And maybe people get excited because they say, oh, there's a PR element to this,
that's
right?
right.
It's a marketing and a PR element to this, and it's cool stuff. Like you want to put on a new server, or so that's not so, okay.
Yeah,
But as you said, it's sort of, I guess it's part of your job to do that difficult explaining, and explain why the boring stuff has to be funded, right? So that's part of your talent that you have to bring to the table, is explaining it, I guess, turning that technical speak into maybe risk speak,
there you
right? So
go.
we turn,
That's
like,
right.
why does this boring stuff, this network stuff, important? Because it equates to increased risk if we don't do these things. And then maybe their ears perk up because they don't like risk, right?
That's right. That's right. And exactly right. So you hit on the point. I think a lot of CISOs uh, that make a mistake. I hear a lot of CISOs use the word vulnerabilities, and they try to talk vulnerabilities. What's the vulnerable? This is vulnerable. That blah blah blah, but they don't talk risk. And senior executives understand risk to the organization. So you got to talk risk. That's the word they understand. That's the model they understand to the business. And if you can explain it to them in a risk to the business, not to cyber, but to the business, because cyber risk is business risk. And so you've got to translate that in what's it going to cost and what's it going to do to our organization in time. If we're down, if we lose it, et cetera, et cetera. And you've got to be able to explain that. That's what I was just doing on the budget call just now. Not my security tools, but I had infrastructure guys, had some stuff in the capital budget. CFO going, why are we funding this? What are we doing this for? And the infrastructure director sitting there going, I have to jump in and say, let me explain the cyber risk if we don't do this. It's not because the infrastructure guy just wants to go do a bunch of new stuff. I'm the one who said we need to do that. So
It's really interesting. So most CISOs come up out of sort of infrastructure, right? Networking infrastructure. They come out of that line. Um, that's not really where you learn how to speak business speak,
right,
right? This is
right,
a completely, so you elevated at some point to this level where you need to almost learn a new language. And
that's
maybe
right,
that's why some people get their MBA or things like that. But if you don't learn that language, you could be the best CISO in the world, technically speaking. But if you
correct,
can't communicate it, the eyes glaze over. They go, we're not funding that. We're going to fund these bots because they sound really, really cool. And,
right.
and then you have breaches because you couldn't communicate properly. So I wonder, do you think this happens a lot, where it's because of where CISOs get elevated from, maybe they don't learn the language, or do we say they're probably not going to get the CISO position if they don't learn that language?
Yeah, great question. So to your point, I've built two programs now. This is the second time I've built a program from the ground up. My first CISO at North Mississippi Health Services and UMC Health System, where I've from. I built that one from the ground up. And at both times I've got vendors, I've got auditors, others say, how are you doing when they come in and they see some of the stuff I'm doing? How are you doing it? And I'll tell you, once they learn my background, then they go, oh, okay, it makes sense. Almost like it's a cop out, almost like, oh, you got, it's like an excuse. I didn't come from that IT technical background. My degree's in psychology. I was a car salesman for many years, and my dad owned a car dealership. And so between sales and reading a lot of Zig Ziglar, right? But between
Yeah.
sales and psychology, and then I was in the Army as an intelligence analyst, having to brief generals and pilots and others on the intel threat. All of that makes me who I am. So I do understand background comes into play. And so what I do is when I talk to, in fact, I have a mentorship program that I work on, and every other Friday I meet with 4 or 5 up and coming CISOs, folks who are trying to want to be CISOs, they're security managers or directors or want to be CISOs. And I tell them all the time the same thing. I've got folks on there that are great technical minds, but they can't speak to at an executive level. They don't have executive presence. And so, I provide them send them books or resources that they need to talk through. I've even hired myself. I've hired an executive coach to talk through those things and figure out where I'm lacking and where my gaps are at. And so, we have to understand where our gaps are. We can't just say, in my organization, this is going to work. There's different levels, and those executives, if you can't speak on their level, you're gonna be frustrated and go, why am I not getting the funding? Why am I not getting the support that I need? Because they don't understand a word that you're saying.
And it's so easy in that situation to blame them
That's
in
right.
your mind, right?
That's
They
right.
don't get it. They don't understand that that's not going to get you anywhere. It's not going to
That's right.
advance your cause. You have to look at yourself and say, why don't they get it? Am I doing something wrong?
Yeah, and I'm a big Jocko Willink fan. If you know Jocko Willink,
No.
he was an ex Navy SEAL. He wrote a book called Extreme Ownership, and so I buy that book for every new employee that comes on board. Any one of my analysts, and we do an offsite once a year just around that book, Extreme Ownership, and we take ownership for if we try to sell something, whether it's an executive or an IT person, even my IT analyst, if they go, a security analyst, if they go to their IT cousins and they try to, hey, we need to do X, Y, Z, and they can't get it sold, it's not they who have a problem understanding, it's me who are having a problem selling it. And so I've even brought in a coach to my team to teach them the 3-part elevator pitch, 3-minute, 3-part or 4-part elevator pitch in 3 minutes. You've got to learn to sell. You got to learn to talk to your audience. And so it's always my fault if they don't buy it. And so that's what we have to understand. What did I do wrong? What can I do better next time to get that message sold?
So it's interesting. A lot of people who aren't forced to do sales at any point or don't wind up doing sales, they think it's a dirty word,
Right.
right? Especially you were in the car business. So, I had that perception, because I was a journalist by training. And so I thought the whole sales element was dirty. Um, but you really got to get over that. Every
Yeah.
job, everything you do, everybody's selling one
Everything.
way or another, and selling is communicating. Um, so but you were exposed to it at a
Yeah.
young age, so you never
That's right.
had that sort of association of unpleasantness. Um, what were
Right.
some of
And
you work for your dad?
no, I didn't actually. When I
Oh,
was,
yeah.
yeah. So when I was 16, I dropped out of high school, and was a bum on the couch. And my dad one day called the house and asked my mom, said, "What's Phil doing?" Well, he's still on the couch watching TV, right? And so he said, send him to my office." So I go into my dad's office, and I go in there, and which is never a pleasant experience at 16, and he says, he gives me this speech, which happened to be a linchpin moment in my life. And he gave me this speech that everybody in town is hiring. You just need to go and get hired. Everybody's hiring. Everybody in their mind, every manager in their mind's got somebody on their team they'd love to get
Yeah,
rid of if they
yeah,
could find the right person.
yeah.
And so he said, I want you to find some place here in town that you want to work at. You go there and find out what time they open up. Be there 30, 45 minutes early and find where the manager puts his key in the door and you're standing right there. So the next morning, I went to one of his competitors and I went to that car dealership. I didn't tell him, right? Because I was just going to do it to spite my dad. And so I go to the competitor And I was there at 5:30 in the morning because that's when Les Solins, the manager, was there. He was putting his key in the door, and I told him, I said, yeah, I'm looking for a job, a little 16-year-old, just, blah, 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 whatever. And it was dark, and Les says, sorry, I don't have anything for you. Okay, great. I was excited. I proved my dad wrong. They're not hiring. You said everybody was. So then my dad told me at lunch supper, said, what'd you do? I told him. He said, good, go back tomorrow.
Ah,
I'm like, what? He said, go back tomorrow. I went back every single day for 6 days straight. And then I said, Dad, he's getting mad. Do you
uh-huh.
understand? He's getting mad. He goes, I'll tell you what, you go back tomorrow and you tell him, listen, I'm not coming back. This is my last day. You've just lost the best salesperson you'll ever have. And Les hired me that day, and changed my life. And I went to work for him. And it was a life-changing experience that, if you want it, you got to go get it, and you can't make excuse. You just go do it, and of course, then that got me into the sales game. But anyway, so yeah, I did have that experience early on, and it's helped me. But again, there's other experiences I didn't have. I was still shy, even though I sold cars. I finally went to college, and I took some public speaking lessons. I couldn't speak very well, and so in college, I decided to take some public speaking courses because I knew that was a gap I had. And so throughout my life, I still look and say, where am I weak at? Let me go work on
Uh-huh.
that. And what's funny? We're talking here, and we're talking about cybersecurity, and what are we
Yeah.
talking about? Really, is leadership stuff, right?
Yeah.
And
Yeah.
that's what it's all about. I'm writing a book right now. A little shameless plug. I'm writing a book right now on the key components of a successful cybersecurity program, and it's all about leadership. As I'm going through each chapter, I'm like, I'm not writing anything about patch management or anything like that. Security leaders, and I'm talking about even managers and below, if they cannot work with their IT brothers and sisters and get them to understand why that should be baked in, if we can't operationalize security with our operational components, if we can't do it with their executives, we're going to fail. And it's not just knowing, like you said, Anthony, it's not just knowing the technical side. If we cannot operationalize what we do by selling it to the executives or even our counterparts in IT, we're going to fail, and it's our fault. And so part of that is understanding our leadership abilities and our sales, components. How do we sell?
Yeah. And then you talk about interacting with IT. What about interacting with clinicians? I mean, that's even
Exactly.
that's a much further elevated skill set right there, right?
That's right. That's right. But I think today we have it much easier than, I've been doing this for over 20 years, much easier today because of, the word is out, right?
Yeah.
And I've even got providers now, physicians that come to me and say, hey, I work on EMR-X. That's my platform. Do we have it backed up? I had one the other day ask me that. That would have never happened 10 years ago for a doctor to be asking if we had software backed up. But he was concerned that what he does for a living could stop because he's got, you know, people that he knows, other physicians in other hospitals that got breached and had ransomware, and there was no backups. And so he wanted to make sure he was okay. So he started understanding that. So I think today we have it a little bit different because it's hit the news. There's doctors who have other friends who are in other hospitals that have been breached. And so they've gotten the word. So it's a little bit easier to, I think, to talk to those clinicians than it was in the past.
And I think that's absolutely right on because I mean, they say, you have to frame things risk. You talk about framing things risk in a risk sense for executives. Well, when you're trying to talk to clinicians, they say you frame it up in patient safety,
Right.
right? But as you said, it's not a hard sell anymore. I think any clinician that puts 5 minutes into thinking about it is scared to death
Yep.
of losing the systems that they use to do their work every day because they have no idea how to do their work without the computers.
Right.
They don't. So as
That's right.
much as everyone talks about backup procedures and tabletops and things like that, I think everyone's in real trouble once the system goes down, no matter
That's
what
right.
kind of things you've
No
done
matter
to
what it
repairs.
is.
Because I don't know how much people are really running through clinicians, getting them to know how to work on paper. I don't think
Right.
that's happening. Do
Right,
you?
right. No, no, that's right. And so I have a BCDR manager that works for me, and she's doing these business impact analysis. I went ahead and said that out, BIA, right? But our business impact analysis with our operational folks, she does all the major silos, system level areas every year, and goes and talks to them and says, listen, if you lost it, how long can we be down? How much data can you lose? All of those different RTO or RPO kind of discussions with them, right? And when we talk to the doctors, they're like, I think IT handles all that, right? I mean, it's just that it's not, I understand, but I'm asking you, How much what's your appetite for loss? And of course, then they get the saucer eyes, whenever you
Yes.
start talking about it, then it becomes real. And I think if you have those conversations, and that's what I was talking about, operationalize. If we don't have those conversations operationally, like I have a cybersecurity council, and that meets every 2 weeks. It's got my executives on it. And I've had CISOs go, good Lord, I wish I could have that. Have that discussion with your executives, and they are my governance council. We're about to stand up on IAM's a subcommittee for IAM steering, and having a bunch of nurses and others on that committee, not IT people. Have
Hmm.
the operational people pull back the curtain, put them on those committees, on those councils, on those governance councils, and it changes the conversation real quick, because all of a sudden they see the risk. You're explaining to them every month what's going on, not just some quarterly report. These aren't reporting. This is decisions. Here's what's going on. And so I think that's the key, is bringing them into the conversation. So when we start talking to physicians in that way and letting them get a voice, it's a big difference.
Yeah, one of the things I've often asked CISOs is where they feel that their responsibility ends, and where sort of the larger entity that's supposed to deal with disasters and emergencies. Because there's an entity in all health systems, I forget what it's called, but they're supposed to manage the overall emergency. One type of emergency could be a hurricane, could
Right.
be whatever, and one of them could be a cyber incident. So I've been told that folks like yourself will work with that larger umbrella entity to make sure they understand different scenarios that could happen. For here's what might happen for a cyber incident, and then those folks essentially should take the ball and run with it, right? And make sure that if the organization had to go to paper, that they could function. So my question to you is, does that make sense? And kind of in a general way, when it comes to disaster preparedness or business continuity around a cyber incident, how far do you have to take the ball before you say, okay, I've done my part now. You guys got to, I'm not going to make sure you know where the paper is and the copiers have ink.
Right.
So,
Right. Yeah, that's a great question. Great point. So, in my last organization, that's exactly what happened. We said we will do the business impact analysis. We will provide some draft copies or some templates on your business continuity plan. Right. Here's a great plan if you want to use it. We even gave workshops. We did these quarterly workshops where we would let them ask questions, and we had the templates there, and help them fill them. But we're not going to do it for you, and we're not going to keep it up to date. That's your job. You need to make sure your business continuity plan is up to date. Make sure you know where it's at. Make sure you drill it. All of those things, and also make sure that I have my business continuity disaster recovery manager have a seat on the safety committee. So we have the hospital has a safety committee that, like you're talking about, and there's a person in every seat from the different parts of the organization, and so that annually when they build out their tabletop exercises, there's a cyber event built into those as well.
mm-hmm,
Or if they say, hey, we're going to do one for tornado, well, guess what tornado also does? Takes out networks and
yeah.
power and other things. So it's also not just, oh well, we lost part of the building, but that might be the power grid area of the building. Let's think what all would happen. And so you can't just, not just about moving patients from one part of the building to another. It could also mean network outage at the same time. So can we dual role this tabletop? And that has been effective as well for them to think outside, because you got power people in there, power, space, and cooling people in those tabletops. But in the past, we've lacked having the cyber side of the house, somebody from IT. So I think you have to have a seat on those committees and talk through it. But you're absolutely right. I think there's got to be a decision line. And I'm also seeing that, I'm starting to hear that shatter across the cyber spectrum as well, around the risk level, right, or the risk area. Where is it a cyber risk and organizational risk? So every organization has a risk, person, whether it's a
Mm-hmm,
C-level
right.
person or a director of hospital risk. And so we hear it now from American Medical Association said, or Medical Association, I think it is. It said cyber safety is patient safety, or cybersecurity is patient safety. All right, and we know that cyber risk is a healthcare risk, or a hospital risk, or an organizational risk. So shouldn't our risk then be reported to the operational or the organizational risk manager or director or chief? Shouldn't they be tracking that? If it's a number one risk, like we got a major problem here with our data center or with whatever, it's massive. Shouldn't that be on their radar? Shouldn't that be an organizational risk? And it
I would
should.
think so.
Yeah, and it should. And so I think a lot of organizations, still haven't risen to that level to where the organizational risk person is in alignment with the IT risk person. They're not working hand in glove.
I
So
wonder if you said what is the most likely scenario of disaster that could disrupt our operations so we can't provide services? I mean, I don't know if depending on some parts of the country, a tornado is more likely than a ransomware event, but in general, I would think
that's
a
right.
cyber event would be the number
Much
one
more
most
likely.
likely thing
That's right.
to cease your operations.
That's right.
So then
Yeah, I
for
mean,
that not to report up doesn't make sense.
that's right. Yeah, I'm in Tupelo, Mississippi, and I'm from West Texas, where Tornado Alley. But I live in Tupelo, Mississippi right now, and I'm telling you, every single year we have a tornado touchdown in our region, in our operating region, and so they're very, very acutely aware of the tornado threat here. But at the same time, um, we haven't had a tornado take out a data center. We haven't had the tornado really take out any of our hospitals. We haven't had any of that. It's touchdown. It's hit neighborhoods and it's hit towns, and we've been affected by it. Our neighbors have been affected by it. Our patients have been affected by it. But we've not had disruption of continuity of operations because of the tornado. But on the other hand, cyber has affected us,
Hmm.
and so you're absolutely right. I mean, the likelihood is so much higher for cyber, and yet those operational risk people aren't even thinking about it. And whose fault is that? Going back to extreme ownership, that's our fault. That's my fault, right? That's our CISO's fault.
Yeah.
That's,
Well,
what I'm saying? Of getting them to understand. Have we had that lunch with them to say, hey, listen, I want to be your best friend. Let me show you. You think you can't sleep at night now? Guess what? You're about to really sleep less, right? Let me show you some stuff. And then show them the metrics, show them the numbers. Because I think a lot of times too is that they don't look at the same periodicals, the same websites, the same Twitter feed, whatever that we do. And so they think, oh yeah, I know there's a cyber threat, but what's happened once or twice a year somewhere in California, that kind of thing.
yeah.
Are they really seeing the same news that we're seeing? Because we keep up with it every day.
I don't know if this is true, but I really think that the perspective of a lot of folks may be, if systems go down, well, let's go to lunch and they'll be up back up. And
Yep.
but it's not let's continue operations somehow. It's like, well, whatever until they come back up. We'll just
Yeah,
wait till
we
they
had a
come
we
back
had an
up.
outage one time at an organization I used to work at. We had an outage one time, and the clinic people just shut down and went home, and so they canceled all their appointments, went home, and
Right.
it's like what? I mean, they're like, well, we got to wait on IT.
Yes.
That was their business continuity plan was wait on
Yes.
IT.
I
It was one
no,
liner.
I really think so because I think
Yeah,
I think unless you're really plugged into the news, most outages are an hour, 2 hours,
that's right.
something's up. So it's inconceivable of weeks. It's inconceivable of no, we actually need to keep running this business, but we don't have our systems.
That's right. Exactly. Yeah, and I'll tell you, I've been in I screamed and hollered when I came here about making sure that even our Microsoft 365 environment was backed up. Because by the way, in case you don't know, that's not automatic. You've got to pay for that. That's
Okay.
separate from Microsoft. So people just automatically assume, oh, I got AWS, I've got Azure, I've got whatever. It's all good. Yeah, just because you're in Azure, just because you're in AWS doesn't mean all the security's there and it's all backed up, right? You still got to do those things. And but because I have been when Microsoft crashes and you
Yeah.
lose email. And you know what we thought? I'm not kidding. We thought, well, if your email crashes, just pick up the phone and call somebody, man. I mean, big deal. You're not going to have email. We did not realize how much people relied on their calendar. I mean, the
Oh
calendars
yeah.
shut
Oh yeah.
down everything. I mean, it's insane the amount of stuff that's on our calendar until that thing went away. And when I mean you lose all your emails, you lose your calendars, you
And
lose all your files, your
your
contacts,
contacts with
everything's
all the
gone.
phone numbers.
That's
That's
right.
where all the phone numbers live.
Everything's gone. I'm telling you, it was a devastating. When you have that event, then you start realizing, okay, we got a problem, and we need to really look at every system that way.
And you realize why that instinct is to say, all right, let's just go to lunch and
Yep,
it'll be up when
that's
we
right.
get
Oh yeah, yeah. We lose. Well, and so when you start looking at that from a business impact analysis on each application, I think a lot of times if somebody on the team who's doing BIAs have never been through an outage, never been through an event, if nobody's in that room's been there, they're going to say same thing I did years ago. Oh yeah, email. They can just please email. They can just pick up the phone and call somebody, right? You blow it off because we don't understand how impactful. And so those of us who've been in the business a long time and have experienced some of these things, we have an obligation then, a responsibility then, to try to craft that message to those clinicians, to those executives, to IT, about the threat, about the experience of what would happen if this doesn't, not just Chicken Little, the hair's on fire,
Right.
but break it down
Yeah.
exactly what's going to happen.
Listen, we're at a half hour where I wanted to keep it. I am going to steal you one more question, and then I'm
Okay.
going to let you go. Isn't it amazing a half hour went by so fast? Um, Rural. So, there's a lot of policy stuff going on now. I get the sense that more and more policy stuff going on. I feel like there's a groundswell of sentiment among cyber folks that the government is going to have to do more, that especially with rural, hey, we just don't have the resources with the adversaries we're dealing with. um and almost like a sentiment of, hey, there's nation state actors out there coming after my health system, no matter how big it is. I'm not as big as a country with
All right.
dedicated cyber criminals, or whatever you're going to put it. Do you get the feeling that there is a little bit of a groundswell of, hey, you're going to have to help us out here, from the government in some sense?
Yeah, and I'm helping to push that swell, because I used to be in the government, and I can tell you that, one of my pet peeves is that, that I'm on the opposite side. I'm on the civilian side, and I'm in one of these critical infrastructure programs. And by the way, we're the most targeted of the critical infrastructure programs, healthcare. And yet, if I get breached, guess what happens? Now the federal government's not only I've got to pay for all that crap, that just got breached, and I've got to deal with all that mess, but now I could get fined by SEC or OCR or whoever. I could have the Secret Service on my back. I mean, I've got all of these regulatory bodies coming after me as well. And so, I think it's important that, we talk about, go back to this. When I was in the government, I did work on a subcommittee for the critical infrastructure program. And one of the things that we tried to do is explain, this was 15, 20 years ago, trying to explain to people who didn't understand cyber back then, if it's a kinetic warfare and a missile was coming in from China and it was going to hit San Francisco, let's say, nobody would expect that the local sheriff's responsible for defending San Francisco, from a missile attack from
Right.
China.
Right.
Everybody understands whose responsibility that is. It's the
Right.
federal government. And yet, in cyber, we have, like you said, nation states that are launching, nation state attacks on our critical infrastructure, on a hospital. And yet I'm expected to defend myself as if I was, the government, the federal government. And yet I can't do any operational stuff. I just have to have defense, and I've got to do that. And to your point, some of us are very fortunate and have some resources, but a lot of rural healthcare has none. They
Hmm.
don't have any resources. They can barely keep I saw today an article, 3 or 4 hospitals shutting down this month. I
Hmm.
mean, just
Hmm.
completely closing down. Don't have resources, period, to keep the doors open, much less
Yeah.
spend it on cyber defense. So it is definitely something that I'm hearing across the spectrum with cybersecurity folks saying we've got to have help. And I think they're doing some to address it. CISA, is an organization that's really starting to work on some of those for resourcing, but they've got to do more, I think.
Yeah, it's scary. It'll put you out of business, right? It can put
Absolutely.
you out of business if
Absolutely.
you're anywhere close to being, your margin. They'll finish you off. It's
Yep.
scary.
Yeah,
Yep.
it is. And unfortunately, in these rural communities, when you say business, it's not just business, it's the patients are out. I mean, we've got areas in Mississippi where if a woman needs OB services, she'll have to drive 2 or 3 hours because those hospitals have closed down. They don't offer OB services in some areas. And so we're talking about patient safety for sure.
All right, Phil, that was wonderful. I want to thank you so much for your time today. I enjoyed it. I mean, great stuff there. Awesome. Appreciate it.
Thank you, Anthony. I appreciate you having me again.